Hello everyone. This video will scrutinize last OET exam that was conducted on 28th of August 2021, and today I'm going to talk about OET writing exam analysis. And the writing task was a transfer letter. I'll be discussing the task with you and I will discuss the model answer as well. So let's begin. So once you receive the question paper, you have to read the writing task first. So I'll read the writing task. Using the information given in the case notes, write a letter to Dr. Clapham, Victoria Price GP. Okay, this means the patient's name is Victoria Price and GP's name is Dr. Clapham. So you have to write letter to the patient's GP explaining your concerns about patient and requesting further investigation. You have to address the letter to Dr. Mary Clapham, GP Padburn. Okay, very clear. So, who's the recipient here? Patient's GP, that is Dr. Mary Clapham. So, why we are writing the letter? To explain concerns about the patient. And the kind of letter? It's a transfer letter. And also, it's a known case. Like in the last video, I already have discussed few things that are very important in case you get a known case. So it was very good that I shared that video just before the exam, and luckily, coincidentally, you got that similar letter in the exam. So in known case, what you have to do? You have to avoid the social history. That is, no need to give any social as well as any medical background of the patient, because the recipient, the reader of the letter, already knows the patient. So start with the event. Do not mention history because that is really irrelevant in this case. So here, when you read further, you'll come to know that the patient is not hospitalized. So, in this case, the background is too much elaborate, so which is very irrelevant. So, after reading the task, you need to identify like what kind of letter it can be. It is a transfer letter, and then we need to also identify whether it's an urgent transfer or it's a normal transfer. So, we'll read the case notes and we'll come to know later on whether it's a emergency or it's a normal one. So how you will design the body, like you'll write the introduction first as usual, and also then we'll go further towards assessment, procedures, then how was patient at that time, and what's the current condition of the patient, why he came, and how was the patient's condition and what you provided to the patient. So various things are there except the background history. Then the suggestions and also information which is needed by the recipient. Now, I'll begin this case notes. I'll read it. So, assume that today's date is 28th of August 2021. You are a school nurse, okay, at Padburn Central School and are concerned about the welfare of Victoria Price, one of the pupils in your care. Patient's detail, name is given to you. Miss Victoria Price, female student is there. Date of birth is given to you, 14 years of age. Address is given. Then social history, social background is both parents deceased. Father in 2008 due to cardiac arrest. Mother in 2012, she attempted suicide. Okay, one brother is there. His name is given and date of birth is 5th of October 2007. And in 2012, Victoria and Jack, her brother, went to live with maternal grandmother. Grandmother deceased in 2014 due to myocardial infarction. Okay. In 2014, current in care, 8 foster families in 7 years. Okay. Initially in same family as brother, currently in different families. Jack 50 kilometers away, siblings last met 6 months ago. No other known relatives. And if you talk about her academic information, school Victoria described as bright. In school, she is a bright student but disruptive by the teachers. Make little effort, even she distract other pupils. No close friends, no evidence of bullying. She used to enjoy sporting activities, particularly swimming, no longer involved in sports. Losing interest since 2014. So from this social history, we just get a hint that she might have some psychological issues, maybe depression or anxiety, or she can be introvert also because she's suffering from psychological issues, maybe due to her parents' death. Nobody close to them, is away from her sibling also, and she might be having problems related to depression. Okay, let's move on to the medical history. Normal height and weight, no previous appointments with school nurse, presenting complaint. 27th of August 2021, she sustained injury to left wrist, hit by a ball during hockey examination. That she healed cuts, left arm uniform pattern clearly made at different times. Victoria, she blames scratches from a pricky bush, maybe self-harming. Patient responses apathetic, not aggressive. The patient seems vulnerable, urgent referral is contacted via worker. Okay. So what happened to the patient? She had injury on her wrist during a hockey match. Then on 28th of August 2021, that is today, discussion with current foster family, Mrs. Farmer, patient living there since March 2021. Mrs. Farmer concerned Victoria increasingly withdrawn and moody, mostly in her room listening to music. Mrs. Farmer also agrees to make appointment with GP as soon as possible to check arm and psychological status. So today discussion was made with her foster family, Mrs. Farmer, and she's also concerned, and she also reported that she's with Victoria is withdrawn and moody, mostly in her room, and she also agrees to make appointment with the doctor. So plan is write to patient's GP. So your task is to write the letter to patient's family doctor. I think the question is very clear to you. The challenge the candidate faced here in the exam was the word count, according to the feedback given by most of my students. So here you know that we should write the word at least 180 to 200 words. So the main question here, students, they just say if you have to avoid social history and medical history, so will they get the desired word limit? So I'll tell you. In this thing, what you have to do is, in such situations, write the sentences in expanded form. Clear? So let's discuss the sample sample answer here. Now you already know that we are going to write the introduction first. So how you will write is, I'm writing to update the current health status of Miss Price as she requires further care, or you can write, you can mention who here. Why you are mentioning who? Because you are already writing this sentence. I'm writing to update the current health status of Miss Price who requires further care and management following her transfer today. This is already conveying that the patient is a known case. If we write, I'm writing to refer the patient who requires, this is wrong. Clear? So here we'll write, I'm writing to update the current health status of Miss Price who requires further care and management following her transfer today. She is suspected to have depression and self-harming tendency. That's it. Very clear from the introduction. Like why we are writing the letter, and the purpose and chief complaints are also mentioned here. So please make sure your introduction should be very clear. Now let's move towards the body part. On 27th of August 2021, Miss Price, or you can write the first name Victoria, presented at school health clinic with injury to the left wrist following hit during a hockey match. So we wrote what happened on 27th of August. On examining, it was revealed that there were multiple uniform cuts on the left arm. All the wounds appear healed, although it occurred at various times. She reported that the injuries were from a pricky bush. However, the wounds were suspected to be as a result of deliberate harm. So you have to mention here that she reported that the injuries were from a pricky bush. However, it was suspected that it is a result of a deliberate harm. So in addition, she was weak and signs of depression including apathy were noted. So in this paragraph, we have mentioned about 27th of August, what happened, why she presented to us, and what happened to her, and what was her condition after that. And also we mentioned that she was weak and signs of depression were noted. So now we'll move further towards the next paragraph, and we'll mention the current condition of the patient. That is today, on 28th of August. Today, the patient's temperamental nature and introvert behavior were revealed by the current foster family. She often sits alone in her room listening to music. So here we mentioned about her foster family, what they told it, what is her current condition. Then next we write, upon transfer, Miss Price is to be provided with further management of injury site along with urgent assessment of her psychological status. So here we'll mention about those things like what is needed after the transfer. After the patient will be transferred to her GP, what we need from the GP, what he need to observe. So what he need to provide to the patient. So here upon transfer, Miss Price or you can write Victoria is to be provided with further management of the injury site along with urgent assessment of her psychological status. Then you can say here, I enclose all the patient's documents. Or you can write the line, all the patient's documents are enclosed herewith. Then the concluding line, if you have any further queries regarding Miss Price, please do not hesitate to contact. Then yours sincerely, registered nurse. Since you know the name of the recipient, you can mention and you have to write your name. If it is not mentioned, you can write Miss. So I think the discussion was pretty clear. If you have any queries, or you have another query regarding another writing question, you can anytime send that questions in the comments. I'll definitely reply to them. And if you have also written the exam letter or you will be writing this letter on your own, you can send it here in the comments. We'll just correct it and we'll discuss. And I'll be uploading more questions regarding the exam. So I'll be discussing the similar questions like this in the future as well. And also in the next video, I'll be discussing other modules like speaking, reading and listening. So stay tuned and wait for the next video. I'll be uploading the videos regarding the exam and also questions similar to this like this time. Just 2 days before exam, I uploaded the video regarding the known case and it came in the exam. So if you have watched that video, I don't think so you have made any mistakes in this letter in exam. So hope for the best. Hope all of you will clear your OET exam and good luck. The people, those who are preparing for their exams, for them also, I just wish them good luck. Just practice and also watch my upcoming videos for your practice. So till then, keep on practicing. Wish you good luck. Thank you.